Mimi naitwa Mandhi Mukuna kutoka Ivumbuni. Tulikuwa tunavijia vijiti kitambo kwa kutoa meno, ile chakula tulikula unatoa na kijiti, unaona damu inaanza kutoka.
I was using a toothstick. I had a bleeding gum which was very painful.
We have a challenge of the diseases which are affecting our community and more so the pupils because of the financial status, and more so when it comes to our dental and also the teeth. That is a problem we are facing with our pupils.
Dental care is basically expensive, and two, it's also unreachable for most people in Kenya, especially people who come from poor backgrounds.
And during practice, a dentist will require expensive materials to use. So when you compound everything together, it becomes an expensive affair in terms of patients' affordability. The most common dental issues we meet as pediatric dentists is an issue of dental decay. We also meet issues relating to the gum infection or gingivitis in children.
We have this organization, the Kinga Africa. Since it came to our school, we have seen they have tried to assist our pupils. The information they are getting, also the education they are getting, they are extending it to the parents. And since it has started in our school, we have seen some improvement.
Kinga Africa is an organization that helps children to know how to brush their teeth. They teach them, and they are like friends, teachers, because they teach us a lot.
My name is Francis Mudama, the founder and the CEO of Kinga Africa, which is a non-profit organization that was founded to enhance communities' health, particularly oral health, because the need for oral health sensitization and access and affordability of dental services is very, 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 very high in Kenya and in other countries in Africa as well. And I thought, well, why can't we start educating the young children in primary schools on oral health so that by the time they become of age, they will actually have adopted this brushing and other oral health techniques early in time.
So the program is aimed at equipping children with skills on how to take care of their teeth, especially through brushing, so that they can prevent themselves from dental diseases in the future.
We brush our teeth in circles, up and down in small circles.
We actually start from the known to the unknown. For example, in some communities, you have to take hold of the traditional chewing stick and then use that to introduce the modern chewing stick, which is the toothbrush. And then we try as much as we can to take them where they should be in terms of knowledge on oral health and other aspects of health that we are also handling. So far, we have reached more than 5 million children and their teachers in primary schools, where we've educated them on oral health, how to brush, when and how, and we've also given them free toothbrushes and toothpaste. And for sure, this is bringing a lot of change in terms of oral health practices at home and in school.
Used to have pupils who had problems of related with teeth, but now that problem has minimized because of that knowledge they are getting, how they should take care of their teeth, how they should avoid eating some foods which can also be harmful to their teeth.
Mtoto wangu alikuwa anaumwa na meno. Kabla wapewe na dawa na kinga, walikuwa wanaenda shule bila kublush. Na siku ile mule watapatia, wakaanza kublush, meno yakaacha kuuma. Hata siku hizo ananiambiangi madadi naumwa na meno, hiyo maneno ikaisha.
Yes, the training has proved to be very important because oral hygiene is one of the daily activities that we practice. I'm going to let the children know about this, and so they will be able to embrace the brushing of their teeth such that their teeth are healthy.
We have another program that we call dental camps run in the communities, where we organize dental camp maybe in the hospitals. We also do them in the communities where we treat them for free. There is screenings, there is fillings, and there is extractions that are done to the patients that visit.
Our camps are free of charge, but that is equally a problem because we have so many people turning out for the camps, actually more than we can manage. But so far so good. We've been able to offer free services, which includes extractions, fillings. We've done dentures as well to the toothless, and they are very, very, very excited about it.
As an organization, we want to help these communities, especially children, to ensure that they stop the bad habits that they would be having that would be detrimental to their oral health, and to bring out a new generation that possibly would be, free of the kind of dental issues that we are seeing plaguing the current generation and even those in the past.
We are also fighting some dangerous dental practices. There is this belief that teething causes diarrhea, and to minimize the effects of diarrhea, the communities have devised their own ways where they extract the developing teeth buds using some crude weapons and in very, very sterile conditions, and this inflicts a lot of pain.
Infant oral mutilation is a practice that is carried out by certain tribes, and it involves traditional or herbalists within the communities gouging out primary teeth, particularly the primary canine, in the hope that they are curing or preventing childhood diseases like vomiting, diarrhea, and fevers. And they use crude instruments in an unsterile environment. The child is likely to contract infection like hepatitis. They are also susceptible to getting infection like HIV/AIDS. Could also lead to destruction of the growing permanent teeth below the tooth they are removing.
So basically what we're doing is that we are educating teachers at the community levels. We are also training community health volunteers and the community at large, mentally on what really causes diarrhea and leading them to alternative treatment for diarrhea.
I am impressed with the work the organization is involved in. As an organization, it is already doing a good job. I, for example, in the area of research and what I'm getting from research, we are going to work together, incorporate whatever information we are getting out of research so that they can also utilize it in propagating their education to the population.
The knowledge they taught me, I shared with my family, because back then we were all using toothstick and it was hard for us. But now I can see very many advantages because they give us toothbrush and toothpaste.
Na mswaki ni mzuri kwa sababu saa ile unaswaka meno haikai kama kipakio. Saa ingine unajua mswaki kikaa kama kipakio utabrush meno yaanze kutoa damu.
We started in my village by visiting one school in a few months. But now the organization has really grown. We have our own offices, and we are also serving almost the larger Kenya now. We are implementing programs in Eastern Kenya, at the coast, in Nyanza, parts of Kisumu, Siaya, Vihiga, and also in Central Kenya.
When implementing the school health programs, we normally face a challenge, especially on transportation of the products, majorly from the office, which is based in Matur, to the areas that we cover, the schools that we normally take the products to when implementing the program.
Some of the places that we work in, the terrain is not that good. So, it calls for some hardy vehicles and things like that. But
our vision is much bigger than what we had initially thought about or what our CEO had planned for. And as at now, we have started the first and only dental hospital in East and Central Africa.
We've built a 4-unit dental clinic that will serve Machakos County, Kitui County, Embu, Kiambu, and other counties around where we have the clinic. This is a facility that will really make a lot of impact when it's operational. We have 4 procedure rooms. 2 are already equipped. As you can see, this is our first room. Yeah, it's fully equipped. We have this wonderful dental unit and quite a lot of the other equipment and instruments that we need. So what's remaining is just a few things here and there, and this room will be ready for use. This is our second procedure room, and of course our second dental unit. All the units are brand new, and they are actually one of the best units we have around, and we are happy to have gotten these ones. I'm sure the dentists will enjoy working in this kind of environment. Right here we have our waiting area. Patients will be sitting here as they wait for treatment. They have hand washing facilities that side, and then we have our reception desk right here. We will put some play items here for children, and of course they will be watching the TV there. We have 2 more procedure rooms that are not yet equipped, so we need additional dental units right inside this room, and this one as well. This is our lab. This is our dental lab. Of course you can see the sterilization equipment. Everything is ready. We have water, we have all that we need here, but now we of course need the dental or rather the dental lab equipment that is not here yet. That's it. We appeal to people of goodwill and donors to come join us in this project, to actually allow us to operate it and to have the patients coming in and the entire community benefiting from the services that they really need.